Okay.
Yeah, let's start.
Yes. Good evening, friends. Welcome to the Winning Edge Talk Show. This is Vishwanath, your host. I'm a sports psychologist and a counselor. I've authored the book Success Mantra in Sports. I have with me this evening Dr. Srikanth Narayanaswamy. Welcome to the talk show, Doctor.
Thank you, Dr. Vishwanath. Thank you.
Thank you. Welcome to the show, Doctor. It's my proud privilege to read out Dr. Srikanth's credentials and qualifications. Dr. Srikanth Narayanaswamy is a consultant musculoskeletal radiologist certified by the Royal College of Radiologists. He is also a sports medicine physician. He was a part of the ABM University Health Board Swansea, United Kingdom. He was a part of the regional sarcoma team managing sarcoma cases in South Wales region. Sarcoma is a type of cancer. He has worked with tertiary ortho centers at Royal Orthopaedic Hospitals, Birmingham and Swansea, UK. He was involved in providing imaging services in sports-related injuries with a premier football club in the UK. He has in-depth knowledge in injury management across various disciplines, including cricket, football, tennis, swimming, badminton, and golf. He provides his services to elite sports organizations in India. He is actively involved in the management and rehabilitation of sports-related injuries with athletes belonging to the Indian cricket team, the IPL team, and the ISL League, etc. Dr. Srikanth is the co-founder and director of YOS Sports Health Specialist Center based out of Bangalore. It's indeed a proud moment to have Dr. Srikanth with us this evening. Welcome to the show.
Thanks a lot, Dr. Vishwanath.
Thank you, Doctor. Welcome to the show once again.
Thank you. Thanks.
Let me begin by asking Dr. Srikanth this question. Doctor, with your vast knowledge of sports-related injuries, please educate the viewers as to why injuries occur in sports.
Injuries are very common. Unfortunately, whatever training that you tend to undergo, there are certain injuries which are bound to happen. So broadly speaking, if you are involved in a contact kind of a sports, whether it is football or whether it's rugby, you tend to have a lot more sort of an acute related injuries. It could be tear, it could be damage to the tendons, damage to the muscles. But having said that, most of these sports injuries tends to be a chronic kind of an injury, wherein it's an overuse injury, wherein an athlete is actually repeatedly moving a particular body part. And if it's not well taken care of, then it tends to manifest in the form of an injury. But we need to understand that there are a lot of factors which come into play. The first and foremost is the physical factor, wherein we need to figure out, is there any biomechanical issue? It could be as well as him having some muscle weakness or muscle stiffness, or it could be just the wrong technique that he is actually sort of doing while during the training as well. And of course, the other aspect is more of a medical related thing, wherein you might have a low vitamin D, and then of course we know that the low vitamin D will manifest in the form of reduced bone density. So obviously, sports involve a lot of pressure which goes through those bones. So if you have a low vitamin D deficiency, then low vitamin D, you tend to have sort of stress injuries tend to be more common. Of course, the last but not the least, and more importantly, it's a psychological thing which also comes into picture. He needs to be in a right frame of mind. He needs to be stress-free. So these are all small things which go a long way in ensuring that he's injury-free. However, if it's not properly taken care of, can manifest in the form of an injury.
Thank you very much, Doctor. Doctor, are sports-related injuries different from sport to sport, and how do they happen? Are they different from sport to sport?
Absolutely. The spectrum of injuries that you see with one particular sport is slightly different from the other spectrum of injuries that we see with the other one. If I give you an example, if you take up a tennis player, a badminton player, you know that we tend to see more of an upper limb related injuries as opposed to, let's say, a bowler who tends to have kind of a back or a lower limb injuries, and so are the footballers who tend to have more of lower limb related injuries. It's not just different in different sports. It's also different spectrum of injuries that you see in a single sport depending on what he does. To give you an example, in cricketers, as I said, the bowlers tend to have more of a back and a lower limb related event, and of course, some amount of upper limb injuries. Whereas batsmen, you tend not to see much of a back injuries. So, obviously the whole spectrum changes depending on which particular sport you play, and even in that particular sport it also depends what you're doing, whether you're a batsman, you're a bowler, or in rugby, whether, or in football, whether you're forward or whether you're defense. So it really depends on the sport, and as well as what you do in that particular sport.
Thank you, Ratan. Thank you for enlightening us. We never thought that injuries can be so different from each sport and each activity. Thank you so much. Do injuries occur due to overemphasis on fitness, conditioning, and due to overtraining?
It's a very, very good question. I mean, in fact, in my clinical practice, if I have to say, I tend to see a lot more injuries again because of a wrong technique that they've done in their gymming activities. Obviously, you tend to see this wrong technique manifesting in the form of an injury, in more so with recreational players than the professional players, because obviously professional players will have a very dedicated set of a team looking after them. But having said that, with a lot of these live apps going through, live sort of training which is coming into picture, people want to be very active. People want to do those exercises. And unfortunately, what we don't realize is if you're trying to do a particular set of exercises, even a slight sort of a change in the technique can actually result in you having an injury. So this is very, very important. It's not just about overtraining. It's also about doing the right things in a right way. And it's extremely important also to have this sort of training and supervision. And so these are sort of small things which go a long way in ensuring that the particular player is sort of.
Thank you, Ratan. Do athletes require to train and condition as per their body type, knowing their body type?
It's a good question, actually. See, we talk about, when we talk about body types, we talk about sort of traditionally speaking, three different sort of body types we talk about, whether they're ectomorphs, mesomorphs, or endomorphs. Ectomorphs are one of those guys who are very, very lean, who don't have much of a fat, whereas mesomorphs are your typical bodybuilding kind of a guys with a broad shoulders and a narrow waist. And whereas endomorphs are slightly over obese kind of a people. But having said that, there is a lot of overlap. I mean, it's difficult sometimes to actually classify them according to which particular body type they belong to. One of the reasons why it is important is because, if you are talking about a lean body type, you tend to actually sort of talk about more of a weight-based training as opposed to endurance, as opposed to, say, an endomorph who is slightly overweight or sort of obese. When we talk about more of a sort of a endurance based, more of running and all those things. So obviously it really depends on which body type that you tend to have. But more importantly, it also depends on which sport you play. Certain kind of a sport will require you to use your upper body much more than the lower chain, whereas other set of sports will require more of your core, your lower chain to be more sort of stronger than the upper body. So there are a lot of factors which comes into play other than your body type when we are looking at the training a particular individual.
So you mean to say athletes need to know what sport they are playing and which type of which areas of their body come into use, and what is their own body type. So
Yes,
based on that, they
absolutely.
can go ahead and thank you, Dr.
Absolutely.
Yes, thank you.
There are multiple factors which comes into play. Yeah.
Thank you, Dr. Then how much will athletes be able to tell how much is too much, where to slow down or when to put a stop?
It's a good question because uh, I mean, one of the things I always believe is that the human body is a beautifully sculpted sort of a gift given by the God. So the body various ways when it is stressed, when it is overtrained, when anything happens to the body. So when we talk about how much is too much, I would like to sort of also talk about, rather than just saying how much is too much, it's also trying to do the right kind of a technique when we talk about this training and all those things. So traditionally speaking, if you talk about any kind of a normal human being, so we always say at least 2.5 to 5 hours of moderate activity, or about 1.5 to 2.5 hours of vigorous activity is somewhat what is recommended most of the time. But having said that, depending on which sport you play, the training duration, the training intensity will differ. To give you an example, if you are training for a marathon or if you're training for an Ironman, your training duration and intensity tends to be much more than the other sport. So to answer your part of the question, how do I know how much is too much? Obviously, our body is going to tell us. And one of the most important signal which body tells you is when you have pain. When you're having that particular pain, it's way of saying you need to stop doing that particular activity. So that's one of the foremost sort of response you get. Not only that, it also affects in multiple ways. Um, you see athletes who are actually overtraining tend to have less of appetite. They tend to be more dehydrated, and also it affects their sleep. They tend to be more insomniac. So there are a lot of ways that it affects, and more so psychologically as well. They'll have sort of poor mood. They'll be quite irritable, quite sort of stressed out as well. So obviously, we need to take everything into consideration when we are talking about how much is too much. So it can manifest in various forms, and of course, right from pain to all the way to psychological issues. So it's very, very important to optimize their training program so that they don't go to that other end of the extreme.
I mean to say our body and mind are always talking to us and we have to listen to them.
Absolutely, absolutely.
Thank you, Dr. I recently heard of the word prehab, something like rehabilitation, something like rehab. Please throw some light on this. That was the first time I heard of this word prehab.
See, yeah. So what happens is, traditionally, if you go back quite a few years back, there was a lot of emphasis more so on how do I manage injury after an injury has happened. The entire injury prevention as opposed to injury management. How do I prevent that injury happening? So that's where this prehab comes into picture, wherein you kind of assess that particular athlete to identify all the risk factors which may potentially come and harm him, whenever he's training or whenever he's going to play in future. You identify all those factors and you customize certain set of exercises so that the chances of him and ending having an injury is less likely. So it's not going to be a one size fits all. It's not one set of exercises which you prescribe across to everyone in rehab. It's quite an individualized thing, wherein it depends on the athlete, it depends on the body type, it depends on the biomechanical issues that they have, and you try to address it before it physically manifests in the form of an injury. So wherein you actually prevent those injuries by doing a proper prehab. Now we have actually shifted our focus from not only from overuse, but also looking at the acute injury. How do I actually ensure that even prevent that acute injury? It could be all your contact sports and everything. So there is a lot of work going on, and the primary focus is more of a prevention that rehab comes into picture as opposed to injury management.
This is all about keeping away the threat posed by the sport and as well as the person, depending on his sport, how to keep it at bay. So, before if it really happens,
Absolutely.
keeping away from the threat
Absolutely.
of the injury.
Absolutely.
Thank you so much. How can athletes prevent injuries from
True.
happening during play and also in their careers, their long careers, during the course of play as well as during their careers?
About say a football, it only lasts we enable, to enable an athlete to go through that the shorter duration, a lot of work which happens in the background. That could be starting from your medical screening, wherein we tend to do certain set of blood tests on these guys. And if there is any deficiencies in those blood tests, we tend to address. That's one way of looking at things. And the second is your physical screening. Most of these athletes will undergo a proper sort of musculoskeletal screening or an FMS screening, wherein we assess their entire body, identify all the issues once again that may come in future in the form of that may manifest in the form of an injury. You identify that and you address that. And of course, these are all the things which goes uh, every year as a part of their life. But more importantly, when we talk about them to be hydrated really well, it's very, very important for them also is sort of an injury free, because obviously we know that all this stress, whether it is stress or whether lack of sleep, will of course manifest in the form. So there's a likely chance that he may fall over. There's a likely chance that there's a twisting injury which is going to happen. Secondary to these small factors. So in nutshell, we talk about bloods, we talk about physical screening, we talk about the medical screening aspect of it. We talk about psychological well-being. When we athlete me week 1 year, we look at when they are playing, what, and then we also schedule their training accordingly. The preseason, season, so everything is charted out for an athlete of 365 days. And there's a lot of work which goes on from the trainers to ensure that these are available to play.
Athletes cannot take physical conditioning and things for granted. They should be very much aware of what can happen, what are the threats, and they should always be in constant touch with their injury rehab specialists and orthopedics and reconditioning specialists. So it helps them because they are all professionals these days,
Yeah.
and there is so much on their head. Such big professionals. Thank you, Dr.
Absolutely.
How do you view the gym culture prevailing in sports today? Uh, is it assisting in training the body effectively? Because we have heard of, for example, Virat Kohli being the first person to enter the gym and the last to leave.
Actually, we need to realize that to be able to reach up to Virat Kohli is just a practice that they have actually done to go up to that particular level. But what I find it really sort of troubling these is that, I have a lot of these young athletes who come in, who idolize these sort of stars, and they want to become like one, they want to become like them within a span of time. That's not going to happen. So that's when they end up either doing wrong things and picking up injuries, and perhaps it needs to undergo a particular sort of gymming activity or any kind of an activity to keep him healthy. But try to overdo things because you want to reach up to that particular whatever idol of yours within a short span of time. That's when things go wrong. I personally, suggest these guys to focus more on the technique, to focus more on the issues that they have, rather than trying to do six packs abs or trying to do all the things which is more of a physical transformation as opposed to helping that one out for a particular sport. So this has become more of a craze, this gymming activities. Yes, I agree, they have to do that, as long as it is done scientifically, as long as there is some evidence to back it up as to why they are doing that particular set of exercises, how it helps in sports, as opposed to them thinking, I want to be like Virat Kohli within 6 months. That's not going to happen, and unfortunately, they will end up spoiling years as opposed to building up on their career.
Doctor, your main area of work is also sports medicine. Tell us more about your work in this area, because this is one thing we don't understand. We heard of sports physicians, sports medicines, and largely we know this as sport orthopedics and injury rehab things, but we don't know what this real term sports medicine means.
See, before I get on to sports medicine, I need to make one important thing. My understanding of sports is quite vast. As in, you can either talk about a professional player who is at a national level or international level, or you can talk about recreational players who were so-called, we call them as weekend warriors, who want to go out and then want to keep active, want to play tennis, badminton, and even to me, sport is anything wherein a particular person is doing an activity. Even a 90-year-old guy who in 200 meters every day, that's kind of an activity for him. That's a sport for him. So my understanding of sport, when I talk about medicine, is from that angle. It's not necessarily have to do with a professional athlete always. So to talk about sports medicine is just a specialized sort of a branch of medicine which deals with sports injuries or musculoskeletal injuries. Any injury which happens to your muscles, your bones, your soft tissues, your tendons. So that's what sports medicine is about. We we have our own sort of clinic called Your Sports Health Specialist, wherein what we do is we have multiple verticals, right from sports medicine to sports radiology to sports physio to sports science to sports masseur. So we tend to combine. We wanted to bring everything under under one roof, so that when a person doesn't have to go through multiple places for what sports medicine mainly involves is mainly looks at a non-surgical way of dealing with injuries. Can I actually make that person recover without necessarily him having to undergo a surgery? There are certain set of injuries like a ligament tears and things wherein he has to undergo a surgery. So a particular tendon or ligament. But if you talk about sports professional person, you tend to see that there's a less likely chance that these guys will go through a surgical route unless they have ripped off a particular structure. Most of the times we can manage them conservatively. We can manage them through rehab. We can manage through a lot of injection options that we have. And as I also it is easy for me. Suppose if somebody walks in, I can just examine him, and if I think that there is an issue related to the shoulder, I can just do a scan there and then, can identify the issue, and then can kind of guide them through the right approach. So yeah, sports medicine has evolved from just looking after a professional person to everyone, from being just looking at treatment aspect out of injections, from being just looking at the rehab perspective to even looking, doing the scans and everything. So it is evolving rapidly, and it's coming into fame a lot these days.
Thank you. Both psychological and mental stress is said to make the muscles taut or tight, resulting in injuries. Please enlighten us with your views on this. Because we as sports psychologists always tell them to keep their muscles relaxed, otherwise your execution will not be smooth.
Absolutely. Stress is a can, as I was talking to you about the other question as well. Stress can manifest in various ways, and it not only decreases the performance, it not only sort of reduces the self-confidence in that particular human being, it also results in the physical manifestation. One of the things is, muscles going in for a spasm, a lot of tightness happening. But unfortunately, what it does to an athlete is that, once your muscles are not actually sort of relaxed, or once it is not functioning properly, you tend to put more, you start putting more pressure on your joints, your other structures tend to take the load. So ultimately what will happen is, you end up having an injury. So that is why we stress quite a bit on muscle relaxations, because obviously you don't want to be in a situation wherein, without addressing the primary stress component, uh, we will not be able to overcome the injury management aspect of it. So obviously, stress is one of the factors which will come significantly when we talk about injuries, and it's very, very important for an athlete to be quite relaxed.
Yes, sir. Thank you. Doctor, when the muscles are relaxed, the execution will not be smooth. So many times it so happens that when muscles are tight, we tend to give more pressure, more hardness into the stroke, whichever game they are playing. So instead of ending, the ball may end up outside the court, or sometimes even in cricket, with the muscles are tight, we end up giving a dolly catch to the fielder. So tight muscles give unnecessary force to the shot, which is not required actually at that moment. That's not how they have
Yeah,
practiced.
yeah.
So many athletes have told me, especially the table tennis players, they said, I have done the service so many times, but I was under tremendous stress. I was so tight that the moment I did the serve, it went outside. That means he has given too much of pressure into the serve, too much of
True,
maybe force
true,
or momentum, whatever.
true, true.
Thank you. Um,
Yeah, true.
an injured athlete is burdened with a lot of negativity, doubt, fear, and insecurity in the mind. Does this stand in the way of his recovery?
Absolutely. I mean, I'm sure people who look after these athletes, whether it be sports physios or doctors or even trainers, will tell you more about it. Uh, See, we need to realize that any sport, it's a very, very competitive game. And what will happen is, if you talk about cricket, you're aiming for that 11 spot, and there are about million people fighting for it. What will happen, especially when you get injured, it tends to affect you psychologically, and it sets in a vicious cycle because you're injured and you're not there in the playing 11. It starts affecting your mind, and whatever I do as a physician, or whatever, or any physios will sort of work on them from their aspect, till the time we actually sort of sit with them, talk to them about the negative thoughts that they have, about the fear that they have. It's not going to help us, because, as I said, it's a vicious cycle. You're injured, you're psychologically down, and if the person is only looking at the injury, it's going to take a longer time. I mean, in fact, they may not even back unless we address both the things parallelly. So in fact, most of the times I actually sit with a particular athlete and I tend to sort of just talk. Yes, a particular injury, and we exactly know that this is the time frame that it takes for him to recover. If he's not in, that duration will almost double up. He may not completely recover from the injury. So it's so much important to actually sit and talk to them and gain their confidence. If you don't gain their confidence, they're not going to open up. If they're not going to open up, we're just actually shooting in the dark without actually doing any good. So it becomes important not only to manage their injuries, but also to manage the psychological aspect of that particular injury.
Because even after their rehabilitation, when they come back to the field, they are afraid to go full stretch, fearing that the injury may reoccur. That's, I think you have faced that. It's
Yes.
too common. Yes. Injured athletes require a lot of
Yes.
counseling and moral support. What role do you play in this?
See, as I said, I actually spend quite a bit of time trying to talk to them, trying to understand their sort of mental well-being, as opposed to an injury. We know that, as I said, we know that every injury will require XYZ treatment, and these things will take XYZ amount of time. But what we have to take into account is how much it is affecting them psychologically. As I said earlier, I can I can counsel them up to a certain extent, but of course, it requires sometimes it requires a proper guidance by someone like you who actually sit with them and get through this psychological aspect. And both of them has to go hand in hand. And if you look at all the teams who have got a sports psychology in place, these teams tend to do really well. It's not about just about when they're injured. It's also keeping them in a particular sort of positive frame of mind, because that goes a long way in terms of performance as well. Forget about the injury aspect of it. So most of the teams, whomever I deal with, if they've got a sports psychology in place, they tend to actually the team tend to do really well as as a team per se. And you also need to see slightly lesser sort of incidence of injuries as opposed to injuries happening left, right, and center. So obviously psychology, I can't stress on the importance of sports psychology per se. It plays a massive role in sports, in an athlete's health.
Most of the time you're dealing with the cause effect after the effect. That is when they come to you with the injured. But the cause can be definitely different. It's the nature of the person, what he is prone to. Does he have frequent somatic anxiety, cognitive anxiety? Are these anxieties and stress leading to the muscle tension and then going on to injury? So the cause can be anything, and most of the time it is psychological. Anything about his life, anything about his the way he reacts to things, how he his perception about things, and how he looks at the whole situation. All this can lead to ultimately to the injury also. Thank you, Doctor. After this,
True.
we have been hearing, we have read about this doping factor, the substance abuse. For a long time, we have been reading about this. The world is very strict on this. There are two organizations dealing with this very strictly. And we have been seeing that an Olympian medalist of the previous Olympics has been stripped of his medal now. Right? That test took so long. So, what is your take on doping?
Um, I, I think every athlete needs to understand one thing, that they cannot just take any medication or any supplement just like that without actually consulting a proper person who understands these regulations, WADA regulations, these doping regulations. And unfortunately, most of the times, what we see is either that particular athlete does not have somebody to fall back on wherein he can actually seek guidance or seek help from. That's number one. It could be as simple as using a cough syrup. Some of the constituents in the cough syrup is actually prohibited from. So athlete education is the most important thing when it comes to doping. So we need to educate them about what all things that they can take, what all things that they cannot take. Some of the organizations that I work with, they've already got a dedicated sort of a doping officer. So anybody who has got any kind of an issue, they can just contact them and I can find out whether they're able to take this particular medication or not. And the last thing that you want, as you rightly pointed out, your medal to be taken back just because of one mistake or one mistake. It could be either a known mistake wherein you knowingly you took it, or most of the times it's basically you didn't know that you had to, you shouldn't be taking this medication. One simple example that I gave you is about cough syrup. And also, most of the times what we see is if a particular physician or a therapist or anybody who's not tuned to doping, then once again an athlete will have an issue. To give you an example, I do a lot of injections, and I know that I can only give X, Y, Z. I give this particular medication doping, as opposed to if steroid, if I give it into the joint for a right medical reason, it is covered. But the same steroid, if you happen to give it into the muscle, which is most often what if a person doesn't understand, if a particular physician doesn't understand about the doping, if he gives it in the muscle, then it's not covered under doping. So there's a lot of thing which goes, especially when we talk about doping, and its main thing is athletes need to be educated about this. They really need to have a particular person to fall back on a particular issue or a concern. And of course, forget about the medication. It's also the supplements that they take. Every supplements that they take, they need to ensure that it's not prohibited in the WADA list. So it's a tough life for them, but of course they need to go through this in ensuring that they come back stronger.
Thank you, Doctor. We have come to the last question of this evening. And Doctor, what advice you have to give to the athletes in particular and sports fraternity in general?
See, I guess to win any kind of a medal, you need to have a very, very good infrastructure in place. You need to have a good training sort of equipment. You need to have a good support staff, both medical staff and as well as coaching staff. And these things can only be provided by the sports federation. And then the final aspect is an athlete's determination to win medals. He needs to put in more than 100% to win those medals. So my only advice for the federation is to ensure that these athletes get the best possible sort of infrastructure available for them, equipment available for them. If you look at the Westerners, they tend to win more medals purely because the infrastructure is quite strong for them. And I think that's where we need to focus our energy on, in ensuring that these athletes get perhaps the same kind of facility what any other country would provide. Once we actually sort of target that particular thing, it's easy for us to win medals almost whatever the other guys win as well, when it comes to Olympics. Yeah, I mean, from athlete point of view, he needs to give his more than 100% in ensuring that he utilizes all these infrastructure and then come back stronger and start winning medals.
Thank you, Doctor. Doctor, we come to the last section of this talk show. That is the question and answer session. And I thank participants for coming on the show. And now you are free to unmute your audios and then ask the doctor any questions you might have. I'm unable to ask to be unmuted. Dear participants, can you unmute your audios? Yes, some of them have unmuted. Please go ahead. One of you can ask your questions. Please go ahead. Yes. Let me unmute them. Ask to unmute. I'm not able to unmute them.
Maybe they don't have any questions.
Anyone, all of you? Yeah. Do you have any questions? I think they are not. Yeah.
Okay, I have one question. So, Dr. Srikanth just wanted to know on what is the protocol you follow to set up rehab program to injury prevention.
See, basically, a particular athlete, as I said, needs to go through a proper kind of a screening assessment. That will be done by dedicated sort of sports physios who will go through a comprehensive, they do a musculoskeletal screening of that particular athlete. And then, of course, also talking about the trainers or sports science people, so they'll go through the FMS screening of that particular individual. So that will actually sort of give us a fair indication of what all things that we may have to address. And, that could be as simple as slightly restricted hip mobility, which may come in the way So that will give us a comprehensive sort of an evaluation of what all things which may come in the way of his career in future, and start addressing that one by one. So that's why I said, it's not going to be one size fits all. It's not just going to be one set of exercises that we prescribe to everybody. So it has to be quite individualized, and it has to be in alignment with the individual issues, which is clinically occult currently, but may come in the way of his career in future. Go through a comprehensive an evaluation initially, and that needs to be done at specialized centers of people who are tuned to doing that, so that the right kind of exercises are given to them.
Doctor, the other question Mr. Arun Rawal had was, do we have any specific software which evaluate training loads?
There is a lot of software which is available. So we use what is called as an athlete monitoring system in our thing, which essentially it gives you everything about a particular athlete. So we not only enter all the physical parameters, we also take into account the other aspects, something like a sleep pattern. Have they slept properly? How is their mood? So there are a lot of factors which one needs to enter, both from an athlete and as well as the therapist who is looking after. So this particular sort of software that we use will, at any point in time, I can go back and look at how an athlete journey has been over the last 1 year, or over the last few years, as long as this data has been entered. It also gives a one snapshot of where he is in terms of his training, where is he in terms of all his exercises, what was the injury that he has had in the past, how long it took for him to recover. It's going to be a cumbersome to note it down on paper. With a lot of monitoring system that we have in place, it becomes quite easy for us to sort of monitor that particular event. And it's a fantastic tool, and I personally feel everyone should be using it.
Thank you, Doctor. And Doctor, Mr. Shiva Prasad has this question for you. How do you suggest we need to handle psychological aspect post-sport injury to enable athlete recover quickly?
So, as I said, there is a lot of sort of a trust which builds up between who's looking after that athlete. In most of the teams, it will be the sports physio. He is his first point of contact. He's the one who would be able to give the other guys, someone like me who is seeing a snapshot of an athlete, about the psychological aspect of that particular individual. But of course, as I've stressed so many times during my discussion with you about the importance of sports psychology. If we don't address the psychological factors, we are not going to overcome their injuries. Even if we were to overcome their injuries, it's going to be only short-lived. It's not going to be a long-lived solution. I personally feel when you talk to an athlete, you'll realize whether this is going to be a mild issue, or moderate, or a severe sort of an issue when it comes to psychological aspect. And I personally, if I think that it will come significantly in their recovery process, if I think that it's going to significantly affect their career, I normally refer it to a specialist, someone like you, who would be able to help them out immensely, as opposed to me trying to do a off-cook job. And try to cover all minor sort of elements of psychological aspect ourselves. But when we realize that it is not going to happen, and we cannot actually do much of help, then obviously specialist help will be required. It is extremely important. I mean, can ruin a career of an athlete. So having an open sort of a mind about this particular psychological element is extremely important as a physician, as a physiotherapist, one of the physiotherapists looking after an athlete. So we really need to look into that aspect as well, other than the physical injury.
Doctor, we're going to take one more question, and this question is from Yatin. Sir, after an injury, will an athlete be 100% the same after he has recovered? It may be back, leg, shoulder, and other too. Yes, this is please,
Yeah.
Dr. We'll take this one last question. He was asking about, Yatin was asking about whether he'll be 100% the same person after he comes back from rehabilitation.
Yeah, so I don't know how much you guys heard me before. So what I was trying to say is we need to not only look at treating the injury, but we also need to look at addressing why the injury has happened in the first instance. So if you talk about a shoulder injury, it's not just addressing about what all things that I need to do for that particular injury. A shoulder injury could have happened either due to a poor strength. So that's the one which we need to address. Once we address both the causative factor and as well as the injury per se, I don't have any hesitation in saying you will come back stronger and you will be, whatever you were pre-injury phase. We never talk about you coming back off cook, you coming back at a lesser intensity. When we bring athlete, he will be 100% on the field. And we ensure that is precisely why we ensure that, we're not just only treating the injury. We actually look at treating the cause of that particular injury.
And also the psychological cause, doctor. There are interventions in sport and physical exercise psychology where we teach them positive affirmations, then talking to themselves positively about coming back stronger, then strengthening their mind. Then there are interventions like allowing the part to relax, allowing the blood circulation to happen. When the blood circulation happens, obviously it relaxes. So all these things we ask them to. Visualization imagery is a wonderful technique for recovery of injury. So all these things we train them to do. This will strengthen, add to the work already you have done. It will always support your work. They go hand in hand.
No, absolutely.
Thank you, doctor.
Absolutely.
I think, thank you very much, doctor. Thank you for coming on the show. You really thrown so much of light on so many factors about difference in the injuries and difference from sport to sport, how they need to know their body, how they need to take care of their bodies, and how they need to look into the causation factors. There's the cause of the injuries that can happen because of the sport and because of their stress levels. They need to understand a lot of things, so much of things involved in this injury and rehabilitation, and about the gym culture. They need to know more about themselves, what they need, rather than imbibing some star or an icon. You shared so much light on so many subject issues, even the doping factor, where they need to be honest about their participation. So many other things. Thank you very much for coming on the show, doctor. It really helped a lot of athletes who are on the show and the entire sporting community. Thank you so much, doctor. Thank you very much. Thank you all the participants for coming on the show.
Thank you.
Thank you. Thank you very much. With this, we end the Winning Edge Talk Show for this evening. Thank you so much.